Namaskar. So, being an astrologer, I came across these cognitive distortions almost daily. And if you have any of these, then cognitive behavioral therapy can surely help you out. So, let's talk about few of them. So, first is polarized thinking. So, if you think either it should be this way or that way, there's nothing in between. Let's say, for example, a guy asked me whether his crush loves him or not. So, he used the word love. Okay, so whether I don't know if it's about lack of communication or lack of vocabulary because I don't know why would someone use the word love ki random for someone random ki whether she loves me or not. But yeah, he asked me. So I said no, I'm not getting any love cards. Then he said, "Oh, she hates me." I said there's so many things, so many emotions in between love and hate. So these kind of polarized thinking. And second, let's talk about second cognitive distortion, which is filtering. Filtering is like you focus only on the negative part and you completely ignore the positive things in your life. So these kind of things like a girl told me that she is going through health problems, bad marital relationship, and she's not able to conceive, and I don't remember the list even. So I asked her that is nothing going good in your life. She said no. I said this is not possible that nothing is good there in your life. So how is it possible? It's that you are not being grateful for anything. So yeah, of course we need to be grateful for whatever we have at least. Third, let's talk about yeah, catastrophizing is expecting the worst case scenario. Many people have this cognitive distortion, like they expect a worst case scenario. And I don't know, maybe it's lack of vocabulary sometimes, like guys ask, or uh, many of them ask, is it going to happen this way, and they asked about the worst case scenario. And I'm like, you are getting too extreme. So third no fourth thing I experience almost daily, uh, I see this thing in my client's life almost daily, is emotional reasoning. So basically people say tell me ki yeah, I have already talked about this projection thing. Like if you feel in a particular way about someone, and you will project your feelings on to the other person, that the other person feels this way for you, and it can be negative or positive both. Also there can be many examples about this emotional reasoning. Like it is like I feel this so it's true because I feel this, so there is no logic. Okay, now let's talk about, yeah, fallacy of change. So this is also very common, like people expect others to change. So today a girl contacted me and she said ki uh, her ex, she said this about her ex, that when will he change, in next month will he get attracted to me again. I said he's your ex now, then why are you asking such question? And this girl has already blocked him and she wants him to get attracted to her again. So there's no logic actually. So there's some kind of obsession. So yeah. Blaming, yeah, that's very common. Blaming, like blaming all the time. So there are also, you must have seen people who are always blaming someone else for their own problems, and they have this victim mentality, like they always try to prove themselves as victim. And this is so irritating that no mature person would like to talk to them, because blaming is such a turn off. And so yeah, I come across such cognitive distortions daily. And let's talk about next, which I come across daily. Yeah, so jumping to conclusions, we have talked about it na, ki jumping, making assumptions based on very little evidence, ki is going to happen this way, or there seems no logic behind that thing. And they always they anticipate ki this is going to happen this way. So basically, you feel that no, you won't feel that, because if you have so many cognitive distortions, you will believe that what you are thinking is right. So you need someone very mature and someone very detached from your problem and from you, who will guide you right, who will give you clarity. And that person can be me, of course, yes. So, or anybody like me. I'm not saying that there is only me in this whole world, but yeah, I'm one of them. So someone who is detached from your situation, and who has some predictive tool. Yeah, of course, like I'm an astrologer, I use my tarot cards, other than my cognitive behavioral therapy skills, to help my clients out. So yeah, so these are the cognitive distortions which are really really very what would you call it, these can be actually very irritating and frustrating for someone. I mean, if I listen to those cognitive distortions, and I try to make them realize at first, do you think that there's any logic in this? And people do realize that, yeah, what you are saying is right. There seems no logic behind our own these assumptions, but yeah, people still want to go with that. So yeah, that's it for today. So the conclusion is that if you have these cognitive distortions and you are not able to get rid of them on your own, then of course you should consider cognitive behavioral therapy. Okay, so bye bye for now. Bye.